Stand up right now. Go ahead. I'll wait. Now pay attention to what just happened in your body. Did you notice a little stiffness in your joints? Maybe a small twinge in your lower back? Or that familiar urge to sit down immediately because standing feels uncomfortable for even a few seconds? That same kind of small but noticeable disruption is happening every single day inside your arteries, and it's far more dangerous than most people realize. According to the American Heart Association, nearly half of all American adults, about 122 million people, have high blood pressure. And here's the shocking part. 75% of them are taking medication to control it. Yet every year, over 675,000 Americans die from hypertension-related complications despite taking their pills faithfully day after day after day. I'm Dr. Michael Kent, and after more than 20 years performing cardiac surgery, opening chests, and seeing the inside of the human vascular system up close every single working day, I can tell you exactly why these medications often fail to truly solve the problem. Because what you've been told about high blood pressure is fundamentally incomplete and based on outdated thinking that hasn't caught up with modern understanding of vascular biology. You've been told hypertension is a plumbing problem, too much fluid pressure in your arteries. Cut sodium, take a diuretic, lower the pressure, problem solved, right? Except that framework is outdated medical thinking from 50 years ago and does not address the real issue at all. The reality is far more complex and goes much deeper than just fluid volume or pressure readings. Hypertension isn't primarily about too much fluid. It's about the pipes themselves. Your arteries are damaged, rigid, and deteriorating at the cellular level year after year after year. Medications can lower the numbers you see on your blood pressure monitor for a while, but they can't repair that structural damage inside the arterial walls themselves. When I perform bypass surgery and open someone's chest, I can see it immediately with my own eyes. Healthy arteries spring back like elastic when touched or cut. Diseased arteries from chronic hypertension feel like cutting into bone, stiff, calcified, hardened, and rigid. And that rigidity? That is what hypertension truly represents at its core. The medications may control the reading for a while, but they do nothing to fix the underlying stiffness and cellular damage in the arterial walls themselves. That is why so many people stay on pills for decades, yet the risk of heart attack, stroke, kidney failure, and other serious complications remains high, even when the numbers look controlled on paper. By the end of this video, you'll understand the 4 hidden mechanisms that create and sustain hypertension and the complete 4-step protocol to repair your arteries at the structural and cellular level. This is not about quick fixes or just lowering a number on a machine. This is cellular biology and biochemistry you can act on today to start reversing the damage that has been building silently for years. Before we continue any further, drop a comment with your age. I want to see who's taking control of their vascular health right now and is ready to make real changes to protect their heart and arteries. Let me explain what's actually happening in your body that nobody tells you about. When you hit your 60s or 70s, your arteries undergo 4 critical changes that directly impact blood pressure and overall cardiovascular health. These changes happen gradually and quietly over many years, but they create the perfect conditions for high blood pressure that keeps getting worse if not addressed properly at the root level. The first mechanism is glycocalyx destruction and endothelial damage. Picture your arteries like smooth, non-stick pipes that blood should flow through easily without any resistance. The innermost layer, called the endothelium, is a single layer of cells thinner than tissue paper. It's lined with a microscopic coating called the glycocalyx. Think of it like Teflon for your vessels. This coating allows blood to flow frictionlessly without sticking or causing friction, signals the release of nitric oxide to keep vessels relaxed and open, and blocks inflammatory molecules from sticking to vessel walls and causing trouble inside the artery. But here's the problem. Elevated blood sugar over time, chronic low-grade inflammation, smoking, even past smoking, and oxidative stress from free radicals destroy the glycocalyx layer slowly but surely. Once it's gone or badly damaged, vessels stiffen, inflammatory molecules adhere more easily, LDL cholesterol penetrates the walls, and plaque begins forming inside the artery. Here's the critical point that most people never hear. No blood pressure medication repairs the glycocalyx. ACE inhibitors, beta blockers, diuretics, calcium channel blockers. They control the number on your monitor, but do nothing to restore this protective layer that nature put there to keep arteries healthy and flexible. That is why people can have controlled blood pressure on medication, yet still develop heart disease, stroke, or kidney damage over time. The glycocalyx damage continues silently, and the medications only treat the symptom, high pressure, not the root cause, damaged lining and loss of protection. The second mechanism is arterial stiffness and calcification. Most physicians focus solely on blood pressure numbers, not whether the arteries are flexible or rigid anymore. Your arteries are supposed to expand and contract like elastic tubing with every heartbeat, absorbing pressure and helping blood flow smoothly throughout the body. But chronic hypertension, diabetes, long-term inflammation, and aging damage the tunica media, the middle layer of your arteries that provides that elasticity. Calcium deposits form in the walls, elastic fibers degrade and break down, and smooth muscle cells transform into bone-like cells, actively promoting calcification and hardening. This stiffening is measured by something called pulse wave velocity. In normal healthy arteries, the pressure wave travels 6 to 7 meters per second. In stiff, calcified arteries, it travels 12 to 15 meters per second, or even faster. Faster waves mean higher cardiovascular risk because the heart has to pump harder against rigid pipes. No prescription medication can remove these calcium deposits or bring back lost elasticity. But with specific nutritional and lifestyle interventions targeted at the cellular level, some of that calcification can be partially reversed and stiffness reduced over months and years of consistent effort. The third mechanism is nitric oxide deficiency. Nitric oxide is a gas molecule produced by endothelial cells that keeps vessels relaxed and open. It's made via the eNOS enzyme, and it signals your smooth muscle cells to dilate, lowering resistance and helping blood pressure stay normal. But damage to the glycocalyx impairs eNOS function. When eNOS becomes uncoupled due to oxidative stress or BH4 cofactor shortage, it produces harmful free radicals instead of beneficial nitric oxide. Without enough nitric oxide, vessels constrict, resistance rises dramatically, and blood pressure skyrockets. Research shows isometric hand grip exercises, squeezing a gripper at 30% of your maximum strength for 2 minutes, resting 1 minute, repeating 4 times. Activate eNOS and boost nitric oxide levels naturally. Even switching to nasal breathing instead of mouth breathing increases nitric oxide production by up to 400% because the sinuses release it into the inhaled air. When nitric oxide levels drop consistently, the arteries stay tight, and no medication fully restores this natural relaxation mechanism that your body is designed to use every day. The fourth mechanism is the insulin-kidney connection. Most people don't realize sodium restriction fails for many because of elevated insulin levels. Chronically high insulin locks your kidneys in sodium retention mode, regardless of how little sodium you eat. Insulin stimulates sodium reabsorption in the kidneys, activates the sympathetic nervous system, fight or flight response, and increases sensitivity to angiotensin II, a powerful vasoconstrictor that tightens blood vessels. This is why people with insulin resistance, even without full diabetes, often develop hypertension that's hard to control. Your fasting blood sugar may look normal on lab tests, and your A1C may be okay, but chronically elevated insulin still drives sodium retention silently and keeps blood pressure high. This mechanism explains why many seniors have resistant hypertension despite low sodium diets and multiple medications. The insulin problem keeps the kidneys holding onto sodium and water, forcing pressure to stay elevated. Consider 2 real case studies to illustrate these mechanisms clearly. John, 71 years old, had hypertension for 13 years and was taking 2 medications. His numbers were controlled at 130/82 on average, but lab tests showed clear endothelial dysfunction and low nitric oxide markers. He felt anxious, fatigued all the time, and frustrated that nothing seemed to help long term. We started the vascular repair protocol, stabilized blood sugar with time-restricted eating and carb control, added fucoidan 800 mg daily to rebuild glycocalyx, and increased polyphenol-rich foods such as berries, leafy greens, beets, and dark chocolate. After 12 weeks, endothelial dilation improved from 5% to 13%, blood pressure dropped to 116/74 without increasing medication, and he felt renewed confidence, more energy, and independence in daily activities. The glycocalyx began to repair, and nitric oxide production increased, things medications alone could never achieve. Martha, 74 years old, had 18 years of hypertension, was on 4 medications, and had severe arterial calcification visible on CT scan, stiff, bone-like vessels. She was afraid of what the future held, constantly exhausted, and doubted anything could change. We implemented a focused decalcification protocol using vitamin K2, MK7, 360 mcg daily to activate matrix glycation protein, vitamin D 6000 IU daily to direct calcium properly, and magnesium glycinate 600 ml daily to regulate calcium balance. After 6 months, her calcium score decreased by 9%, blood pressure dropped to 122/78, and she reduced medication from 4 to 3 under doctor supervision. After 18 months, she was on one medication with excellent control, and her CT scan showed a 16% reduction in calcification. These examples demonstrate how structural vascular repair, targeting glycocalyx damage, calcification, nitric oxide deficiency, and insulin-driven sodium retention, can dramatically impact health when you address the real causes instead of just managing numbers with more pills. Now let me teach you the vascular protocol, a 4-step approach targeting these mechanisms directly. Step 4. Glycocalyx restoration. Stabilize blood sugar below 140 ml/dl post-meal through time-restricted eating and carb control. Provide building blocks with fucoidan 600, 1,000 ml daily, a seaweed-derived compound that supports glycocalyx repair, and reduce oxidative stress with polyphenol-rich foods such as berries, leafy greens, beets, dark chocolate, and green tea. This step rebuilds the protective coating, improves blood flow, reduces inflammation, and helps prevent plaque. Step 3. Decalcification. Activate matrix glycation protein, MGP, with vitamin K2, MK7 form, 180/360 mcg daily to prevent calcium from depositing in arteries, support proper calcium incorporation into bones with vitamin D 6000 IU daily, and supplement magnesium glycinate 400-600 mg daily to regulate calcium balance and relax vessels. This step softens stiff arteries over months and reduces calcification. Step 2. Nitric oxide restoration. Protect the eNOS cofactor BH4 with folate, 400-800 mcg, vitamin C, 1,000-2,000 balarmi, and vitamin E, mixed tocopherols. Stimulate eNOS via isometric hand grip training, 30% max strength, 2 minutes hold, 1 minute rest, repeat 4 times per week, and practice daily nasal breathing to increase nitric oxide production by up to 400% compared to mouth breathing. This step relaxes vessels naturally and lowers resistance. Step 1. The insulin reset. Reduce insulin levels through time-restricted eating, 16.8 fasting. Eating window noon 8 p.m. is a good starting point, and resistance training 2 to 3 times weekly to increase insulin receptor sensitivity on muscles. Step 1 is the most powerful because it unlocks your kidney's natural ability to balance sodium and pressure, addressing the root of many resistant cases. Here's what to expect realistically when you follow the protocol. In week 1, you may notice subtle improvements such as less morning stiffness, slightly lower blood pressure readings in the morning, and a small increase in energy. By week 2, systolic blood pressure often decreases noticeably. Many see 8-15 points drop, and energy and mood improve noticeably. Weeks 3 to 4 bring measurable improvements in vascular function, nitric oxide levels increase, and early reversal of calcification begins to show on follow-up tests for some. Beyond week 4, structural improvements appear: reduced arterial stiffness, lower cardiovascular risk markers, better endothelial function, and the potential to reduce medications gradually under physician supervision. This is not gradual symptom management. It is structural vascular transformation that addresses the root causes at the cellular level. Now, let me be very clear. This protocol is not a cure for hypertension and is not a replacement for medical care. Never stop prescribed medications without explicit approval from your physician. People with kidney disease, heart disease, or diabetes should implement these steps only under close medical supervision to avoid complications. Start conservatively. Pick one step at a time, monitor your blood pressure daily, morning and evening, and track how you feel. Gradually add additional steps as your body adapts safely. Always work with your doctor to interpret changes and adjust safely. Here's my challenge. Pick one element of the vascular protocol, maybe stabilizing post-meal blood sugar, starting vitamin K2, doing isometric hand grips, or trying time-restricted eating, and commit to it consistently for 30 days. Track your results carefully. Blood pressure readings, energy levels, mood, any stiffness changes. Then come back and leave a comment sharing what happened. Your arteries have carried you through decades of life. They deserve better than being written off as just aging or treated only with pills. If you found this information valuable, make sure you're subscribed. Next week, I'll cover the single most overlooked nutrient for cardiovascular reversal, and one of the tips will surprise even seasoned doctors. Stand up for a moment. Did you notice any stiffness in your knees or back? That same silent stress is happening inside your arteries right now, and it's far more dangerous than most people realize. According to the American Heart Association, nearly half of all American adults, around 122 million people, have high blood pressure. Here's the shocking part. 75% of them are on medication to control it. And yet, every year, over 675,000 Americans die from hypertension-related complications despite following their prescriptions faithfully. I'm Dr. Michael Kent, and after more than 20 years performing cardiac surgery, I can tell you why medications often fail to truly control this disease. Most people are told hypertension is a plumbing problem. Too much fluid in your arteries. Cut sodium, take a diuretic, watch your numbers. But that framework is outdated, misleading, and keeps millions of people at risk. The real issue isn't fluid. It's arterial damage and stiffness at the cellular level. Healthy arteries are elastic, springing back when blood flows. Chronically high blood pressure damages this elasticity. Medications manipulate numbers, but cannot repair damaged arteries. By the end of this discussion, you'll understand the 4 hidden mechanisms driving hypertension and the 4-step protocol that can repair your arteries naturally at the structural level. Before we continue, drop a comment with your age and how long you've had high blood pressure. The first hidden mechanism is glycocalyx destruction and endothelial damage. Picture your arteries like smooth, non-stick pipes. The endothelium is a single layer of cells lining every artery, protected by a microscopic coating called the glycocalyx. Think of it as Teflon for your arteries. This layer not only ensures smooth blood flow, but also prevents inflammation and produces nitric oxide, a molecule that keeps vessels relaxed. When this protective coating is damaged, blood sugar spikes, chronic inflammation, smoking, and oxidative stress strip it away. Once destroyed, arteries stiffen, plaque forms, and nitric oxide production drops, causing blood pressure to rise. Blood pressure medications do not repair this coating, which explains why people often feel at risk despite controlled numbers. The second mechanism is arterial stiffness and calcification. Many physicians focus on blood pressure numbers but overlook whether arteries are flexible. Over time, calcium deposits accumulate, elastic fibers break down, and smooth muscle cells begin behaving like bone cells, making the vessels rigid. Pulse pressure, the difference between systolic and diastolic pressure, is a key indicator. Normal pulse pressure is 40-50 meter/second. Anything over 65 suggests stiff, calcified arteries. Pulse wave velocity can measure this stiffness directly. Healthy arteries allow the wave to travel at 6 to 7 meters per second, while stiff arteries see 12-15 meters per second. Blood pressure numbers may appear normal, but arterial rigidity increases the risk of heart attack and stroke. The third mechanism is nitric oxide deficiency. Nitric oxide is produced by endothelial cells and signals vessels to relax. When the glycocalyx is damaged, nitric oxide production drops, leaving arteries constricted. Natural ways to boost nitric oxide include isometric hand grip exercises, squeezing at 30% of maximum strength for 2 minutes, resting 1 minute, and repeating 4 times a week, which can lower systolic blood pressure by 8 to 12 points. Nasal breathing also helps, increasing nitric oxide levels by up to 400%. The fourth mechanism is the insulin-kidney connection. Elevated insulin blocks sodium excretion by the kidneys, which raises blood pressure. This occurs even in people without diabetes if insulin levels are chronically high. Time-restricted eating, such as a 16-hour fast with an 8-hour eating window, combined with resistance training 2 to 3 times a week, improves insulin sensitivity, unlocks the kidneys, and normalizes sodium excretion. To illustrate, John, a 71-year-old with hypertension for 13 years taking 2 medications, had controlled blood pressure at 130/82, but showed endothelial dysfunction. After stabilizing blood sugar, taking 800 mg of fucoidan daily, and incorporating a polyphenol-rich diet of berries and leafy greens, his blood pressure dropped to 116/74 in 12 weeks. Endothelial function improved, and he was able to reduce medications after 6 months. Similarly, Martha, 74, with hypertension for 18 years and severe arterial calcification, followed a protocol including vitamin K2, MK7, 360 mcg daily, vitamin D 6,000 IU daily, and 600 mg of magnesium glycinate daily. Within 6 months, her arterial calcification score decreased by 9%, blood pressure dropped to 122/78, and she reduced medications from 4 to 3. After 18 months, her calcium score improved by 16%, and she maintained excellent control on just 1 medication. The 4-step vascular protocol to reverse hypertension begins with glycolytic restoration, which involves stabilizing blood sugar below 140 mdl post-meal, taking 600-1,000 ml of fucoidan daily, and consuming polyphenol-rich foods such as berries, leafy greens, beets, dark chocolate, and green tea. Step 2 is decalcification, achieved by activating matrix Gly protein with vitamin K2, supporting calcium absorption with vitamin D, and supplementing magnesium to prevent inappropriate calcium deposits in the arterial walls. Step 3 is nitric oxide restoration, protecting the ENOS enzyme using folate, vitamin C, and vitamin E, performing isometric hand grip exercises 4 times per week, and practicing daily nasal breathing. Step 4 is the insulin reset, implemented through time-restricted eating and resistance training to improve insulin sensitivity and allow the kidneys to excrete sodium properly. When following this protocol, realistic expectations include subtle blood pressure improvements and increased energy in the first week, noticeable decreases in systolic pressure by week 2, improved endothelial function, and early calcification reversal in weeks 3 and 4, and structural transformation of the arteries beyond week 4, potentially allowing a gradual reduction of medications under physician supervision. It is crucial to consult your doctor before making any changes to prescribed medications. People with kidney disease, heart disease, or diabetes should seek medical guidance before starting this protocol. Begin gradually, 1 step at a time, while monitoring blood pressure daily. Here's my challenge. Choose 1 element of the vascular protocol and commit to it for 30 days. Track your results and share your experience in the comments. Your arteries have carried you for decades. They deserve repair and care. Hypertension is not a permanent life sentence. It can be reversed by addressing the underlying cellular mechanisms. The 4 mechanisms, glycocalyx restoration, arterial decalcification, nitric oxide production, and insulin normalization, provide a roadmap to repair your vascular system. Medications manage symptoms, but understanding and correcting the root causes can normalize blood pressure naturally. Implementing these steps can help prevent cardiovascular events and improve overall vascular health. Make the choice to pursue reversal, not just management. I'm Dr. Michael Kent, and I'll see you in the next video.